Hello, listeners, and welcome back to Let's Talk About It with Q. I'm listening. This episode, I want to welcome my guest, Richard Capriola, onto the show to share some very helpful information about adolescent substance abuse. He's the author of the book, The Addicted Child, A Parent's Guide to Adolescent Substance Abuse. He has over 2 decades of experience treating teens and adults with mental health and substance use disorders. I'm really, really excited to have you on the show. It's a very close to home topic for me having kids of my own. So I'm very looking forward to our conversation today. Welcome, Richard.
Thank you. Thank you. It's a pleasure to be here with you to talk about this important topic. Thank you so much for inviting me into the program.
Oh yeah, no problem at all. So now now you said so you've had over 2 decades of experience treating teens and adults for mental
Yes.
health and substance use disorders. Tell me a little bit about your history with that.
Well, I began in the field of education. I worked as a state level school administrator for about 3 decades and then transitioned from that career over into mental health and substance abuse. Started working at a mental health crisis center and
Okay.
then accepted a position at Menninger Clinic in Houston, Texas, which is a large psychiatric hospital where I worked with both teenagers and adults diagnosed with a mental health and a substance abuse disorder. I worked there for over a decade, treating both teens and adults. And so many times I would sit across from a family and I would go through their child's history of using a substance and give them a diagnosis of a substance use disorder. And many times they would look across at me and they would say, I had no idea this was going on. Or if they did
Yeah.
suspect their child was using a substance, they would say something like, well, I sort of knew something was going on, but I didn't know it was this bad. And
Yeah.
and these are good parents. These are very good parents doing the best job they can. They miss the warning signs because nobody told them what to look for. Um,
Yeah.
so after I left Menninger, I wrote this book, The Addicted Child, A Parent's Guide to Adolescent Substance Abuse. I kept it to around 100 pages because I know parents are busy. They don't have time to read volumes of information on
Mhm.
this. But I wanted to give as much information as I could in a short book that would hopefully help parents feel a little bit more confident, less afraid, and feel that they understand this topic a little bit better. They know what the warning signs are, and if they have to deal with this issue, they know the steps to take.
Yeah, no, that's really really good. That's such a great premise for a book because I like you said, parents are busy, and even the best parent doesn't always see signs or symptoms, and like you said, they don't
Right,
always know the signs and symptoms of those
right,
things.
right.
And even for myself, like I grew up as a teenager, experimenting with substances, and my parents had no clue.
Right.
To this day, I don't even know if they have a clue um except for me being candid as an adult from time to time with them, but other than that, they had no clue. And I have a 22-year-old daughter, and um for the most part I did recognize when she was smoking pot, but luckily she never went past that. um well, experimenting with alcohol also,
Yeah.
but nothing ever more than that. But but I only knew the signs and symptoms only because I knew them from myself being a teenager.
Right. That's
But
right.
but I mean, if you've had no experience with that or anything like that, then how would you know?
Yeah, and I think that's a very good point. If you haven't had experience with a substance, say like marijuana, you don't know what to look for. And kids are very clever; they know how to
Hmm.
fly under the radar.
Oh
And
yeah.
and the other thing is that parents all too often have think that this can't happen to my kid. This is something that happens to other kids. This can't happen to my
Mhm.
kid. And unfortunately, that is a misperception because every child is vulnerable to being captured by drugs or alcohol. It doesn't matter where you live, urban, suburban, or rural area.
You're
It,
right.
it doesn't matter what your level of income is. It doesn't matter where you send your child to school. Every child is vulnerable to being captured by some type of substance.
That is very true. I agree with you 100% on that. So now, I guess, let me dive in. So, which drugs are teens using nowadays? Because I know that in my time, I grew up and it was mainly just marijuana and alcohol. But
Yeah.
as I got older, though, I went into what they call the rave scene with rave music and stuff like that. And there was like hallucinogenics and stuff like that in that
Yeah.
area. But is that what's still going on nowadays, or?
Teenagers, for a long period of time, for years, have gravitated towards alcohol and marijuana. Those are the two primary substances that adolescents have been using for a long, long time.
Yeah.
Prior to the pandemic, what we did notice was a tremendous increase in what is known as vaping, where a teenager will take a substance like nicotine or marijuana. They'll use a vaping pen, a vaping
Oh, yeah.
instrument that turns it into a vapor, and it turns the substance into a vapor, and then they inhale it. Well, for about 3 years prior to the pandemic, there had been a surge, an alarming surge in the number of teenagers that were turning to vaping. So I would add vaping of either nicotine or marijuana, along with regular marijuana and alcohol as the primary substances that teenagers are using. There is some experimentation of the more so-called hard drugs, things like cocaine, methamphetamine, prescription drug abuse,
Yeah.
Adderall, Ritalin, but really those percentages tend to be less than 5% of teenagers.
Oh, that's good numbers.
Yeah.
That's really good numbers because I know I do remember when like the big epidemic of prescription drugs were a thing.
Yes.
Um, and there was a big epidemic, but I didn't know if that was still going on or not. As
There still is some abuse of prescription drugs, especially drugs like Ritalin and Adderall. Those
Yeah.
tend to be around 5, 6, 7% of teenagers. So it still is a problem, but in comparison to the number and percentages of kids that are smoking marijuana or vaping or drinking alcohol, it's a much, much smaller percentage.
Okay, all right. Well, that's good to know. That's really good to know. Now you said previously before the pandemic, how has the pandemic changed teen drug abuse or teen drug use, do you think?
Well, what we noticed was during the pandemic year, which was primarily 2021, last year,
Yeah.
there was a significant decrease in adolescent substance abuse
Mm.
across all substances. Alcohol, marijuana, and nicotine, and even vaping declined significantly. For example, the percentage of high school students that were drinking alcohol dropped from 55% to 47%.
Oh, wow, that's a big drop.
The percentage of 10th graders who were drinking alcohol dropped from 41% to 29%.
Wow.
And even marijuana and vaping percentages declined during the pandemic year, during 2021. And I think a lot of that is because kids were isolated at home. They were doing online instruction. Many of
Mhm.
them, they weren't involved in a lot of their peer activities, social activities, or academic activities. And I think a lot of their social interactions was through social media. So I think
Yeah.
the opportunities just weren't there for them to be able to continue using the substances that they had been using. Now, we'll find out early next year if in 2022, this year, if if the adolescent substance abuse rebounded and went back up.
Yeah.
Now, ironically, while substance abuse went down during the pandemic, the mental health crisis increased.
Oh, I could see that. I could definitely see that with the mental because I know I have a 11-year-old and soon to be 13-year-old, and it definitely has played a role
Yeah.
for them and our family just with anxiety and
Yes.
depression and stuff like that.
And kids across the board were reporting those symptoms of anxiety. Some were reporting depression. Some were feeling lonely.
Mhm.
Many were afraid for themselves and their families. So I think
Yeah.
we're just scratching the surface on how the pandemic affected adolescent mental health and adult mental health too, because families and adults were affected as well.
Oh, yeah. Yeah, no, it definitely affected, myself also, just
Sure.
the just the whole thing about it. So how would you say the pandemic changed teen mental health and treatment, if so, like to how they're getting treated for it now?
Well, for 10 years prior to the pandemic, we had already been witnessing a crisis in teenage mental health. This has been
Yeah.
going on for a long time. From 2009 to 2019, there was a 40% increase in high school students reporting feelings like hopelessness and sadness. There
Mhm.
was a 36% increase in teenagers seriously considering suicide.
Oh my
So
gosh.
we'd had a mental health crisis even before the pandemic. Then the
Yeah.
pandemic comes along, and feelings, symptoms like anxiety, depression, they almost doubled among the teenage population. And emergency room visits by teenagers for suspected suicide all increased. And kids across all grades were reporting feeling anxious and angry and annoyed. Many felt bored and sad and lonely,
Mhm.
and many experienced sleep problems. So the pandemic sort of ignited this mental health crisis that we'd already been experiencing among our teenagers.
Yeah. Well, yeah, and I'm sure for among adults too, but the
Yeah,
teen
yeah,
things, it's really, really important for
yeah.
them with their mental health and going through hormone changes and all that kind of stuff.
And for parents that are interested, on my book's website, I have a blog article, which is, about 10 questions, 10 very simple questions that you can ask your child, your teenager, to check in on their mental health. Just 10
Oh,
very
good.
simple questions. For
Yeah.
example, one of them is, what 3 words best describe how you're feeling right now? What three
Oh, that's a good
words?
one.
Another one is, that I think is interesting, is if your feelings were weather, what kind of a day would it be outside?
Ah, I
Um,
like that one.
so these are real simple things that you can use to check in with your child from time to time, just to get a quick reading
Yeah.
on their mental health at that particular time.
Yeah, I'll definitely be checking that out and asking my kids because I like that. It's I think those are good. Those two examples that you gave are really good.
Yeah.
It just kind of like it's not directly asking them, um, but it's letting them kind of put it in their own words.
Yes. Yes. And express to you maybe what's going on inside of them at the moment.
Yeah, yeah, yeah. Because sometimes it can be hard for teens to express exactly
Yeah.
how they're feeling too.
Right, right, and that's a simple way to at least get some type of indication of what's going on.
Yeah. Now, what are some of the warning signs for teen drug abuse these days?
Well, in my book, I have a listing of warning signs for a teenager that might be drinking alcohol. I have other warning signs for a teenager that might be using marijuana. And I have warning signs for a child that might be developing an eating disorder,
Oh, okay.
or who might be self-harming, because sometimes, not always, but sometimes, uh, eating disorders and self-injury will accompany a child using a substance. So I think it's important that parents at least be familiar with these two disorders and know what to look out for. So I included them within the book. As a general rule, what I say to parents is pay attention to the changes that you see in your child. You know your child better than anyone. So pay attention to the changes that you see. Don't assume that the changes you're seeing is just normal adolescent acting out behavior.
Yeah.
It may very well be that, but it might also be an indication that there's something else going on underneath the surface that you need to be aware of. So, for example, a child whose grades are starting to decline, a child who starts getting into disciplinary problems at
Mhm.
school, a child who used to participate in extracurricular activities, sports, or some other activity, no longer shows an interest or a desire to participate, a child who used to introduce you to their friends. You knew who their friends were. You might
Yeah.
have even known who some of their family members were. Now becomes very secretive about who their friends are, and becomes very secretive about where they've been.
Yeah.
And then, of course, if you find any drug paraphernalia or any unusual odors coming from their room or their clothes, that's an obvious sign that
Yeah.
you might want to follow up on. Now, if some of these symptoms, sort of come and go rather quickly, it's probably not too concerning, but the longer they go on and the more of these symptoms that you see, then the more concerning I think a parent should be, and then you wanna follow up and get some of the assessments that I've recommended in my book.
Oh, okay. All right. And what I was going to say, what kind of assessments
You want an addictions assessment so that you can get an overview of what your child has been using, how often they've been using, what they've been using, and if it's appropriate to that your child has a diagnosis of what we call substance use disorder that can either be mild or moderate or severe. So you want a good overview from a professional about the substances that your child may be using and whether or not they warrant a diagnosis of a substance use disorder. The other thing that you will want to get done is a psychological assessment,
yeah.
because you want to rule in or rule out if there are any issues that your child may be developing that they are using a drug or alcohol to medicate. Examples would be
Mm,
anxiety,
yes.
depression, trauma, bullying, for example, that you might not even be aware of.
Yeah.
Because in some cases, not all cases, but in some cases, a teenager is using a substance to medicate an underlying psychological issue that unfortunately often goes undiagnosed. So it's very important that if you suspect your child is using a substance, that you also get a good comprehensive psychological evaluation to rule in or rule out if any of those issues are present.
Yeah, and that's a good point that you bring that up because I know for my older daughter, she did tell me when we had to talk about it and she had, came to me and said that she was smoking. She had said that it was alleviating what she felt was nervousness and
Yeah.
stuff like that. And then we ended up going to Kennedy Krieger and she got treatment for anxiety and OCD.
And a lot of the kids that I dealt with, a lot of the teenagers that I worked with at Menninger Clinic, who were smoking a lot of marijuana, often, many times a day, and these were very bright kids. Their IQs were above average. When I asked them to help me understand why they were smoking so much marijuana, the number one answer that came back was it helps me with my anxiety. So
Hmm.
that's an example, once again, of how for some children they're using a substance to medicate what I refer to as some type of intolerable thought or feeling or
Yeah.
memory, and they've stumbled upon it. Maybe it's marijuana, maybe it's alcohol, maybe it's some other substance, and they found that they get relief from those intolerable thoughts, feelings, and memories. And
Hmm.
once they get that relief, they're like adults. We don't like sitting around with uncomfortable thoughts, feelings, or memories. So we're going to do something about it. And when we find a substance that takes care of it, a teenager is going to most likely continue using that substance.
Yeah. And now I noticed you said substance use disorder. I've
Yeah.
never heard that term before. What I guess what would be considered or how do you classify something as being a substance use disorder?
Well, we used to call it abuse and dependency,
Yeah.
but we have changed that in the new diagnostic manual that we use
Hmm.
to diagnose people. And we changed it to recognize that it's a disorder, and we call it a substance use disorder. And it ranges from mild to moderate to severe. And what categorizes those three areas is the extent to which the substance is disrupting a person's life.
Ah.
So if it's not very disruptive, and many kids will fit into the mild or the moderate category. Once it gets to the severe category, really we're looking at situations where there are serious consequences. The behavior is out of control. The use is out of control. They've developed a tolerance to the drug, which means they need more and more and more of
Hmm.
it over time, and they really are facing some serious consequences as a result of the drug. Some kids will fit in that category, but I think an awful lot fit in the mild to moderate categories.
Okay. All right. Um, and now how can you prevent teens from getting into drugs in the first place, do you feel? Is there a way to do that or some suggestions or
Yes, yes. What I found in working with teenagers is it didn't do me any good to tell them that the drugs are illegal. It didn't do me any good to tell them the drugs are bad for them, or if they continue to use, their grades might drop, they might not graduate, they might not get into college, or they might not get a job. They didn't believe any of that stuff.
Yeah.
So it just didn't matter to them. So what did matter? What mattered to them was the neuroscience. They were very
Oh,
curious and interested about how their brain works. So I would spend time educating them on their brain, simple things,
yeah.
like the fact that their brain's not fully developed until around age 24 or 25.
Mhm.
It's in the process of maturing during their adolescent years. What different areas of the brain are responsible for, so that they could see that there's an area of the brain that helps them talk, an area that helps them walk, an area that helps them process information. I would show them a chart, and I have it in my book, of of the brain and what the different areas of the brain are responsible for. And then I showed them another chart, which is also in the book, that shows them where marijuana attaches itself to in the brain. So they could
Oh, okay.
very quickly see how marijuana was working in their brain and the different areas of the brain that marijuana affected.
Yeah.
That made an impression that they were interested in. So my recommendation to parents is, and you can start this in elementary and middle school, talk about the brain, educate them about the brain when they're young.
Hmm.
And then
Yeah.
as they get a little bit older, once they have an understanding of the brain, when they get a little bit older, maybe middle school or high school, you can start to talk to them about how drugs work within the brain. First, educate them about the brain because they're
Yeah.
curious about that, and
Yeah.
then use that as a route to be able to talk to them about how drugs work in the brain and how drugs can affect the brain. Kids are likely to be very interested in that, but telling them
Yeah.
that drugs are illegal and no good for them is not going to work.
Yeah. Yeah. No, that is very true. From own personal experience of teenage years, that did not work.
Yeah,
Um, and but that the brain thing's a really good idea. I
yeah.
mean, that's really really smart.
And I put a chapter in my book, a brief chapter on the neuroscience, so the parents could begin to understand the importance of the brain, how the brain works, how it affects behavior, and just give them a basic understanding of appreciating the fact that the adolescent brain is in the process of maturing, and maybe how they can use that to educate their child. Because if a child understands how important their brain is and how these drugs work in the brain, it might help steer them away from experimenting with these things.
Yeah. No, I think I agree with you on that. I definitely agree. So now what would you say? Well, we kind of touched on this for a minute, but how strong is the correlation, would you say, between teen mental health issues and drug abuse? I know they kind of can go hand in hand at time, like you
Yeah,
mentioned, but
yeah.
um, is it a big do you find that most of the teenagers that had drug abuse issues were having mental health issues underneath?
The ones that I worked with did, but also I worked in a psychiatric hospital. So,
Oh, okay, yeah.
most of the kids who were coming to the hospital had a primary diagnosis of some type of mental health disorder.
Gotcha.
They were also using a substance. I think that maybe the number and the percentage of adolescents who are using a substance who also have what we call a co-occurring disorder, a mental health disorder,
Yes.
is probably underestimated and unfortunately undiagnosed and untreated.
Yeah, no, I could see that definitely because I know for myself, I'm bipolar and have anxiety and depression and stuff like that. But it took a very long time for it to get diagnosed. Probably into my early adulthood life, it took.
Yeah, and many times when a parent discovers their child is using a substance, the entire focus gets on the substance,
Yep.
and they don't stop to look at, because nobody suggested that they do this, taking a look to see if there's a mental health issue behind the substance use. So they focus on the drugs, which they should, but oftentimes the mental health issue gets undiagnosed and also untreated.
Yeah. Well, I could see that definitely. Now, would you say that there's what's my question? What am I trying to say here? Um, would you say that there's any correlation of like history, like family history of drug abuse with teens that have substance abuse issues at
Yeah,
all?
that's
Have you found that to be a thing?
that's an excellent question because what the research shows is that somewhere between 40 and 70% of a person's vulnerability to become addicted, so to speak,
Yeah,
is purely genetics.
yeah,
And that's true of any disease. If you have
true.
hypertension in your family, you're more at risk. If you're a woman and you have a history of breast cancer in your family, you're more at risk. If you have diabetes in your family, you're more at risk. Doesn't mean you're going to get the disease. It just means that genetically you're a little bit more at risk.
Yeah,
The same is true for addiction. If you have that in your family line, you are more at risk. Now, that's 40 to 60%. So what's the remaining percentage?
yeah,
The remaining percentage is environmental factors. It's
mm,
high levels of stress,
yeah,
levels of abuse, all of the psychological disorders. So you
yeah.
take the genetics and then you take the vulnerability from the environmental factors, say a lot of anxiety or maybe depression or some type of trauma, and you add that to it, and the person is more likely to get involved with drugs.
Okay, okay. Um, so now, is there anything else from your book that really stands out to be something to be said about this teen drug abuse epidemic that we're having?
Yeah, I think not so much the epidemic, but in my book, I have resources for parents. I help them to understand if their child needs a treatment program, what to look for in an evidence-based treatment program. I have a suggested questions that they can ask a potential treatment program. I explain the difference between the different types of treatment programs because
Okay.
many kids will do very well in an outpatient program where they see somebody maybe once or twice a week.
Hmm.
Other kids will do very well in what we call an intensive outpatient program where they might see somebody 4 or 5 times a week.
Yeah.
And then for some kids, especially the ones who have a dual diagnosis, where they have a substance use disorder and a severe underlying mental health issues, there are residential programs that a child can go to that will treat that child usually for months. But those are usually in situations where the substance abuse and the mental health issues are both very severe. So I wanted parents to understand what the full range of treatment is and what is available for them. The other thing that I would say that I want parents to latch on to understand and know about is there is a sense of hope here. That's what I
Okay.
want parents to know. There is hope. We know that treatment works. We know the earlier a parent can catch the warning signs and intervene and get their child into treatment, they and their family can get through this. We
Yeah.
know treatment works, and we know that parents and their families can get through this. And the other thing that I would emphasize that sadly doesn't get enough emphasis is if you're a parent and you're going through this with your child, get support for yourself.
Oh,
So
yeah.
many times parents will go through this alone, either because they're ashamed
Hmm.
or they feel as if they've been a bad parent and they question,
Yeah.
how did I miss the warning signs? What went wrong? What kind of a parent I am? So they feel very, very badly about
Yeah.
themselves. So I recommend if you're going through this, build a support system around yourself. Maybe it's a family friend, maybe it's a good friend, maybe it's a support group from your church or your school or your community, but build a support system around you because if you have a child that you're going through treatment with and you're going through this crisis with, this is going to be a journey. It's going to take some time, and
Yeah.
you deserve to have support around you while you are trying to support your child and your family.
Yeah. Now, I know you had mentioned like an intensive outpatient program.
Yeah,
And I actually am in one for my mental illness right now. This is my last week, but we do a lot of group therapy and then we do
mhm.
individual therapy. Is that kind of the same thing that goes on there as talk therapy and
Absolutely.
stuff like that?
Absolutely. If a child is in in an intensive outpatient program or a residential program, they're going to be immersed in exactly what you were talking about, the examples that you gave. Part of their time will be in group therapy, and part of their time will be in individual therapy. So, absolutely, you got it right in terms of exactly what goes on.
Okay, okay. And is it like they teach you like skills, I guess, like healthy coping skills and stuff like that?
They will teach you helping coping skills. Some of them will focus on mindfulness. Some
Okay,
of them will
yeah.
focus on dialectical behavior therapy. Some of them will have classes for like artwork to express
Oh,
yourself.
okay.
Many of them will have residential programs. Will have opportunities for sports and exercise. And then there is individual treatment that accompanies the group. So it's a combination between groups and individual therapy.
Oh, that's good. That's really good. Now, and is with the outpatient, not the less intensive one, is it kind of the same thing but on a smaller scale, like being seen 1 to 2 times a week?
Yeah, and that is where usually doesn't involve group activity. It's more of an individual counseling session, therapy session,
Mhm.
where you will be working with an individual over a period of time that will be working on your various issues. It's almost like an individual treatment program.
Oh, okay. All right. Now, do you feel like this is well, I guess you said we'll see the numbers after the after this year or whatever, but do you feel like we're heading in a good direction with the epidemic of teen drug use or
Well, I think in about early next year, we'll know if the decline in substance abuse during 2021, during the pandemic year, has rebounded, and we see an increase in terms of kids returning to substance use, and if so, how extensive is it? Did it rebound to say the 2020 level or the
yeah.
2019 level? Did it level off? And there wasn't a significant increase. So it'll be very interesting to see what the data for 2022 shows in comparison to the pandemic year. We may see an increase, but the question is going to be how significant an increase do we see?
Yeah.
So I think it's going to be very enlightening in terms of the data that's coming out from 2022.
Okay. And like I know for myself with my kids, when we were talking about warning signs, this I was thinking my kids they suffer from depression, so a lot of those signs are the same for for drug abuse
Yeah,
also though.
yeah,
And so I'm wondering how much harder it will be to if I ever need to track or trace, you know, uh whether or not they are using drugs, how much harder that will be when they already have the mental health issues of, retreat, like, losing interest in things
yeah.
and that kind of stuff. And I don't know if it'll be a harder journey for us, maybe.
It can be because the issues can become more complicated and more complex, and that's why I suggest that parents get a comprehensive assessment. Don't just focus on the alcohol and drugs. Focus on
Yeah.
the other issues. Get a psychological assessment from a psychologist or a neuropsychologist, somebody who can do the testing and give you feedback as a parent as to whether or not these other psychological issues are there? And if so, how serious are they? And are they contributing to the child's substance use? I think the professionals will be able to assess that and give you the feedback and the recommendations as a parent that you will need
Yeah.
in terms of how to move forward.
Okay. All right. And now, do you feel like, because, there's definitely a large increase in social media and and kids being online with each other and stuff like that. How much do you think that that affects the teenage substance abuse and stuff?
That's an interesting question because I, I I I do another interview, and if you're interested, we can get into this in another session. But I do a session that is on social media and teens. And I
Ah,
talk about the different apps that kids are
yeah.
using, which ones are more popular.
Mhm.
I talk about, what the cyber experts recommend as the appropriate age for your child to begin using apps.
Yeah.
I go over the Facebook research that was done on teenagers using social apps and some of the statistics that are there, particularly how this is affecting the self-image of teenage girls.
Yes. Oh gosh, yes.
So I think there's a lot of insight in those statistics, and then I sort of review some tips and some recommendations that came out from Mayo Clinic. But there's no question that parents need to be aware of these social apps, the extent to that children are using them, and how they are potentially affecting children and what you can do as a parent to monitor and safeguard your child if they are using these social apps. So if you're interested, we could schedule a time to talk about that. It is an issue that I think is concerning to a lot of parents,
Yeah, definitely.
and many parents are just not aware of the extent
Mhm.
that kids are using these apps and how it's affecting them, and how that they as a parent can take action to make sure that their child is using them appropriately.
Yeah, no, I would definitely love to have you on again to talk about that subject because that is a really big one that I think, and like you said, for teenage girls especially,
Yeah.
and I could see how with self-image issues and stuff like that, how that could put them on a track to try drugs and alcohol and stuff like that. You know, the
Absolutely, absolutely, because if their use of a social app is negatively affecting their self-esteem, and it might
yeah,
lead to feelings of hopelessness, might feeling of depression, and they stumble into a substance, sure, it could lead to
yeah,
that.
definitely. Now, how long how many times do you think that a parent well, I know that if people fall through the cracks, unfortunately,
Yeah.
and do you have a statistical number on how much, like, how I don't wanna say unsuccessful, but, I guess how many teenagers end up falling through the cracks because of not having this information that you're providing?
I think a lot of families and a lot of teenagers sort of, fall by the wayside. I think a lot of families miss the warning signs, and
Mhm.
then it escalates and it gets out of control and it becomes a crisis.
Yeah,
And then they're confronted almost in a panic situation what to do.
yeah,
And I think there are an awful lot of children that unfortunately go undiagnosed, either for a substance use disorder or for a coexisting disorder. And I think that there are a lot of kids out there that are suffering, and a lot of kids out there who are using substances that parents do not know about. The other thing that I would add is there are two things. I believe there are two factors. I think there's two factors that drive the substance abuse that we see among the teenage population. And the first is availability.
mhm,
These drugs are widely available to kids and they know it.
yeah,
When we ask uh, when we ask high school seniors, how easy is it for you to get marijuana? Over 80% of them tell us it's no big deal. When we ask them, how easy is it for you to get alcohol? Over 90% say it's not a problem. It's no big deal. And they also report it's very easy for them to get a hold of things like cocaine and amphetamines and tranquilizers. So these drugs are
jeez.
widely available, and
Yeah,
kids know it. The other issue, besides availability and how readily kids can get their hands on these substances, they don't think they're harmful. So
yeah,
when we ask them, high school seniors, when we ask them, how harmful do you think it is to smoke marijuana on a regular basis? On a regular basis, how
yeah,
harmful do you think it is? Only 22% of high school seniors tell us they think that's harmful. Only
really?
22%. And about the same percentage tell us that they don't think it's very harmful to have a one or two drinks of alcohol nearly every day. They don't
Oh
think it's
my.
harmful. So,
Wow.
these drugs are readily available and kids know it. And unfortunately, for many of these drugs, they don't think they're very harmful.
Now, do you think that society and how society views these things play a role in that? Because I know that, like, for myself and my own experiences, like in my family, alcohol, like my parents never did drugs or really drank or smoked or anything like that. But I know that, like, my ex-husband, he grew up in an environment where it was acceptable, and he's still um kind of like, oh, it's okay to have a beer every day after work, or it's okay
Mhm.
to have a couple beers after work. And it's kind of like it's not it's socially acceptable. And I wonder if teenagers get that, like, this nonchalant attitude about it because of the social acceptance of these things.
I think they can. They see what their parents are doing, and if and they pick up on that, and if they think something is socially acceptable, they think it's okay too.
Yeah.
But what they miss, um, is what is acceptable for adults is
Yes.
not necessarily
Mhm.
acceptable for a teenager. Again, back to the brain. You know, we have marijuana legal in many states
Yeah.
for adults, not
Yeah.
adolescents, but
Yeah,
for
yeah,
adults.
it's yeah, here in
Um,
Maryland, you can get a medicinal card.
Yeah. So, but what teenagers miss in with the misperception, well, if it's okay for mom and dad, or if it's okay for adults, or if it's legal for adults, it must be okay for me too. It can't be all that harmful. But what
Yeah.
they miss is the fact, yes, it can be harmful for you because unlike the adults, your brain is more vulnerable. Your brain is maturing. So your brain is much more susceptible to damage when you introduce these substances than, say, an adult.
Yeah. And now what are some of the, damaging things that can happen to a early, like, a brain that's still developing with drug abuse and alcohol?
Well, the example that I can talk about is that these kids that I worked with who were smoking marijuana, these were all very bright, intelligent kids. Their IQs were above average to superior, but they were smoking a lot of marijuana, oftentimes multiple times a day.
Oh.
But when the psychological test came back on these kids, what I noticed was that the processing speed of their brain was below average, their
Oh.
short-term memory was impaired, and their
Mhm.
motivation was significantly reduced. Now, some of these things, like the short-term memory and the processing speed of the brain, might not be readily observable to a parent,
Yeah.
but those things behind the scenes, underneath the surface, are going on inside that child's brain. So the processing speed of the brain is slowing down, and the short-term memory is affected, and that might come across in terms of their academic performance. It just might be a little bit more difficult for them to remember some things
Yeah.
that are going on in the classroom or for a test. So those are some examples of how some of these drugs can affect the brain that might not be readily observable, but when you do a deeper examination and assessment, unfortunately, oftentimes you can see some of these changes going on. Now, the good thing is we know that our brains have a remarkable capacity to heal themselves. Before the adult stops using a substance, our brain goes into recovery and starts to heal itself.
True, that is very true, which is amazing about the brain.
It is.
Um, so now, do you feel like there's, how am I trying to say this? Do you feel like there is a correlation of, um, I guess, kids that, like, what do you think starts teenage drug abuse in children? I know we said the cohabit, having a mental health issue could
Yeah,
definitely,
right.
but sometimes that it doesn't always have to be a mental health issue, right?
No, every child is different, and how they get into drugs is different for every child. Some of them, as you just noted, and we've talked about, is the underlying psychological issues where they will use a substance to medicate that issue,
Yeah.
anxiety, depression, or some other disorder. For some kids, it's peer association. who they're
Yep.
hanging around with.
True.
For some kids, it's peer pressure. They
True.
feel pressured to do it. For some
Yeah.
kids, they just get curious and interested in it. They try a substance, and if they like it, they may continue. If they don't like it, they may not. So,
Yeah.
there's different routes that a child might get introduced to a substance. Every child is different. But for some, it's the underlying psychological issue. For others, it's peer pressure, it's peer influences, it's opportunity, and then
Yep.
experimentation just to see what it's like,
Yeah. And like you said, also probably availability.
and
That's right. Yeah.
availability. That's right.
Yeah, definitely availability. Because I know that I remember growing up, uh, we had I had a friend whose aunt smoked marijuana and it was readily available to her. So that's how we would get it, as she would just take it from her aunt.
Yeah,
And
it's
then,
readily available. They're
yeah,
gonna, they're gonna be tempted to use it, to
yeah,
experiment with it.
yeah, definitely. Is there anything else you can think of in your book that would be important to mention or talk about?
Well, I think we've covered the basics. I think one of the most important parts of the book is to learn about the neuroscience, and to learn about the warning signs. And my goal is that people who read this book will feel less afraid, less paranoid,
Yeah.
and more confident that if they have to deal with this issue, they feel better prepared to be able to do it. At least that's my goal in terms of what I would hope that somebody who reads this book, what they get from it.
Yeah, well, I'm definitely going to be getting this book because I think it's such an important topic for, especially in our country and our society nowadays.
Thank you.
Now, have you ever done studies of overseas in other countries how teenage drug abuse compares to
No,
America?
no, I haven't. But I know that this is an issue that is global. The percentages might differ. The dynamics may differ a little. Even the substances might differ. From country to country.
Yeah.
I focused on the United States, but by all means, I think that this is a problem that affects teenagers around the globe.
Yeah. Yeah, no, I definitely, yeah, I could see it definitely affecting everyone in the world, especially with the pandemic happening for everybody
Yes,
in the world.
yes, absolutely.
Now, where do you see yourself taking this in the future? Do you looking about writing more books, or is
No,
this
I'm
your
not I'm not thinking about writing another book. I've been devoting most of my time in terms of trying to reach out to people like yourselves and to parents, and helping them to learn a little bit about this topic, let them know about the resource of the book, and trying to, get as many people curious about this topic, so that they can become better informed about it. That's been my goal.
Okay, well, that's a really good goal to have. I feel like this is a really I feel like this is a subject that I don't know if people take it lightly, but I don't think it's emphasized enough
Yeah,
in
yeah.
our society.
I agree. I agree.
Oh, well, Richard, it has been wonderful speaking with you. I can't thank you enough for coming on and sharing all this information. I want to make sure that everybody knows about the book. And so, would you go ahead and say the name of the book again so that they know where they
Yeah,
can get the book?
yeah. The book is The Addicted Child: A Parent's Guide to Adolescent Substance Abuse. It's available on Amazon as both a Kindle and as a paperback. You can also go to the book's website, which is www.helptheaddictedchild.com. Helptheaddictedchild.com. And on the website, you can read blog articles, you can read endorsements for the book and some book reviews. You can look at a sample chapter. There's a link that will take you directly to Amazon, where if you want to purchase the book as a Kindle or a paperback, you can do that. And
Okay.
there's also a link that if you have a question or an issue, and you want to send me a note on it, you can do that, and it'll come directly to me.
Oh, that's wonderful. That's really good. Now, have you gotten a lot of positive feedback with that? Because I'm assuming parents must reach out to you to.
I really haven't. I tend to get more advertisers responding to it than anybody else, somebody trying to sell me something.
Yeah.
I did have one family that contacted me that requested to talk to me, and I immediately followed up with them, and we had a phone conversation for about an hour. So
Oh.
I just want people to know that, that if they have a question or they want to contact me, that if they go through the website, it'll come directly to me, and, please don't hesitate to do that.
All right, and now, so I know you said you had worked with adults and teenagers. What made you reach out to this specific topic about teenagers as opposed to anything else with adults or anything?
I think it was with my work with teenagers and families, and seeing how families were going through such a crisis, how they were, going through quite a difficult time, how they were feeling, terrible about themselves as parents,
Yeah.
and how they were sort of questioning, well, what went wrong? How did I not know this was going on? What kind of a parent I am? So, I saw so many parents that were going through this struggle that I wanted to give them a resource, that I wanted parents to have a resource that might help them be able to avoid the struggle that I saw so many parents going through.
Oh, that's wonderful. Yeah, because I can't even imagine. As you're talking about it, I did, the first time with my older daughter, it did feel that way. Like, what did I
Yeah,
do wrong?
right.
How could this happen? And I blamed myself for having the genetics of, I did it. That's probably why she's doing it, and da da da
Yeah.
da da, and all that. And I definitely could have used a resource back then
And
to.
those are all very, very normal, very healthy, very common characteristics. But as you've experienced, I'm sure, they can be very difficult for parents to deal with.
Yeah, definitely. And especially like you said, there's a lot of shame and guilt
Yeah,
and not really feeling like you can speak up about it or share it with other people
right,
who don't understand what you're going through.
right. Yeah, that's true.
So that is really smart that you said to have someone that you can reach out to, or
I
a
think
community group or something like that, anything like that.
I think that's so important.
Yeah. All right. Well, thank you so much, Richard, for coming on the show and talking about this really, really important subject. I feel like everybody um should know about it. I mean, even if you don't have kids, people always know teenagers in
Yeah,
their family,
right.
neighbors, friends. Sometimes it takes a village to raise a child.
Absolutely,
So I
absolutely.
think that that's definitely this is definitely something that's wonderful. And thank you so much for coming on. I really appreciate it.
Well, thank you for inviting me to the program. Thank you for participating in the discussion and for your insights and your history and your excellent questions. I hope that everybody who listens to us, gains some information and feels a little bit more confident about this topic. So thank you so much for inviting me to the program.
Oh yeah, no problem. And I'll definitely be getting in touch with you again to talk about the social media and teens. I
Yes.
think that's
Okay.
another important one.
Okay. Great.
All right, great. Well, you have a wonderful evening.
You too. Thank you. Bye bye.
All right, thank you. Bye. So, guys, that was my conversation with Richard Capriola about teen substance abuse, and it was very, very near and dear to my heart. I really appreciate him coming on and sharing that information. Definitely get the book and check it out. I'm going to be doing that. I'd like to give my shout outs to Jake Dante at Off the Mats Podcast and Tiana Taylor, Instagram handle Tiana underscore Taylor underscore BJJ. Um, I'd just like to tell everyone out there I'm listening, and you guys all have a good evening, and I will be back in touch with you soon.